I'm Dr. Leibovitz, your Central Indiana go-to foot doc, and we're going to take a few minutes to talk about how to prevent fungus from getting into the nail. Now we're dealing with a normal nail. If you see discoloration in the nail, it has fungus already involved. That's not going to be a prevention, that's going to be a cure. We'll talk about that in another video. If the nail is the same color as your thumbnail as it is on your toenail, great, we're dealing with the normal nail. So there's two main causes that allow fungus to get in the nail, and it's trauma. Macro trauma, dropping something on your foot, injuring the nail, there's bleeding underneath the nail, it causes a black or blue nail, it results in nail separation. An ingrown nail will also produce trauma and allow fungus to get between the skin and the nail and cause a fungal nail. There's also micro trauma, a repetitive injury. Runners, dancers, stop and go athletes, even a new pair of shoes can cause this. This is where topicals, I think, have a very good role in prevention. It's not a very good treatment for eliminating or curing it, but is a nice treatment for prevention. And make sure that the topical medication has an active antifungal ingredient in it. We're not dealing with oils or Vicks Vapor Rub or vinegar, or the snake oils you see on social media or late night TV. This will only delay treatment. By that time, if you get a fungus in there, we've lost the idea of the prevention. The goal is not to let the bad guys get underneath the nail. These are dermatophytes, and once they get underneath the nail, into the nail bed, it's a very protective place that they hide, and it's very difficult to get rid of. And the fungus is everywhere. It's waiting for that opportunity for the nail to be damaged to jump in. So start using the antifungal topical immediately after an injury. I would suggest using it till the nail looks completely clean, and then I'd use it for an additional couple months. There is a great article on my webpage, what does a fungal nail look like? It goes over a normal nail that's been injured. You see the changes going on with the fungus, the separation, then we treat it with the topical, and you see a normal nail appear in about a year. Okay, the second thing that can cause fungal nails is nail polish. Chronic use of nail polish. It provides a great hiding place, a favorable environment for fungus. They think it's a party. The question is, how long do you need the polish allowed to be used? That's a good question. My suggestion is for every week that you have polish on, I'd go 2 weeks off, and during that time use an antifungal medication to help prevent that. Now be careful, read the ingredients on your polish. Most of the cheap polishes have solvents and preservatives that are really caustic and damage the nail. That's how fungus can get in there also. I suggest using a medical grade polish. There's a couple boutique polishes, they're called pspolish.com, as well as Dr. Remedy. I think those are a good alternative. They actually have ingredients that are really healthy for the nail. I'm not convinced that using an antifungal on a nail that has not been damaged is very helpful. I think that may lead to some resistance, so be cautious of that. Well, if you learned a few things, hit the like button. If you have a tough time sleeping at night, hit the subscribe button and you'll get more information like this. My webpage has a lot more information, articles and videos about onychomycosis and nail problems if that interests you. Well, thanks for listening. I'm Dr. Leibovitz, your Central Indiana go-to foot doc.